So I have the pleasure of announcing the next panelist, and also please, if you're speaking next, turn on your camera so that we can start to see everybody. But so this, continuing the conversation, continuing talking about the importance of really connecting pieces that are often siloed, which women know are very much connected into the fabrics of their everyday lives, and how we can more intentionally have those partnerships so that we are leveraging and facilitating connections across movements. So this next panel is it's our movements working at the intersections of reproductive and economic justice to improve women's reproductive health, freedom, and autonomy. It is going to be moderated by Galina Espinosa, President and Editor-in-Chief of Rewire News Group. And I will let Nicole introduce Galina, and then Galina is going to introduce the panelists.
Well, I'm really excited about this panel and conversation. Galina is the leader of Rewire, an organization that for many, many years has been the media arm of the reproductive rights and justice movement, telling the stories, keeping us abreast of what's been happening across states, and helping us to understand the experiences of women related to reproductive health and rights. And you have her bio, and so I'm not going to belabor it. And again, Galina has been a champion, a colleague, a friend of mine, and has been doing extraordinary work in her role as president and editor-in-chief of Rewire News Group. So Galina, I'll turn it over to you.
Fantastic. Thank you for that introduction, Nicole. And I am, of course, thrilled to be here, particularly because I feel like I have this heavyweight panel that I am thrilled to be in conversation with. So let me go ahead and introduce the incredible speakers that I have the privilege of discussing this issue with today. I'll go in alphabetical order. So I'll start with you, Anne-Marie. Anne-Marie Benitez is the Senior Director of Government Relations at the National Latina Institute for Reproductive Justice, where she oversees all government policy and policy advocacy work. So I would bet she's been pretty busy recently. Marcella Howell, wonderful to see you. Marcella is the founder, president, and CEO of In Our Own Voice, National Black Women's Reproductive Justice Agenda. Marcella has spent more than 40 years advocating for women's rights, reproductive health and justice, and women's empowerment. And Minia Palacio is president and CEO of the Guttmacher Institute, a leading research and policy organization focused on advancing sexual and reproductive health and rights in the United States and around the world. And finally, we have Shannon Rees, who is the executive director of Atlanta Jobs with Justice, a coalition of faith, community, labor, and student leaders committed to economic justice in Georgia. Panelists, thank you so much for being here. We are going to dive right into it. I'm a journalist, so I have to start with the news. And all we have been talking about at Rewire News Group is the alarm bell that the Supreme Court sounded pretty loudly on Monday when it announced that it is going to take up this Mississippi abortion case, Dobbs versus Jackson Women's Health Organization, which could truly be the case that ends abortion access as we know it. And let's be honest, abortion access is not necessarily in the greatest of states right now, but the thought that that could be completely taken away is something that I know that we're all truly terrified about. So I would love it if I could hear from each of you as organizations that will be directly impacted by this Supreme Court ruling. If you could talk about, since the Monday announcement, I'm sure you have regrouped with your teams. I'm sure you have started to think about the best and worst case scenarios that could result coming out of this case. And to be clear, we're not going to have a decision for at least a year. So there's time to plan. But what are you starting to plan about? What are you feeling more hopeful about? What are you feeling less hopeful about? And Anne-Marie, let's start with you.
Thank you very, very much. I really appreciate being part of this amazing panel with awesome colleagues. So one of the things when we talk about Roe versus Wade, we like to lift up one thing that is true, has been true for our communities for quite some time, is that Roe hasn't been there for our communities. So our communities have already been negatively impacted by access for quite some time. One of the earliest examples of that was at the federal level when Congress rolled out the Hyde Amendment, which blocks Medicaid from using federal funds for abortion care. And that was just the beginning. And from then, little by little, across the country, we saw states taking more and more abilities and access and creating many more barriers to abortion care. So it really became in our communities about access, because while the choice may remain from the legal framework, right? Access wasn't a reality for our communities, and that's been a reality for quite some time now. And as you can see, like the states have been going intensely crazy since, for quite some time. But you saw a real uptick in 2010, and it's continued since then. And thank you, Gutmacher, for doing a lot of that trend watch and finding in all the state trends. So that's more our reality, that the courts haven't saved us. We don't rely on the courts because this is not going to be one on that front. How it's going to be one is from our communities. And what gives me hope is that every time we either go from the state level and we go into our communities and we increase education about what's going on at their states, people get angry immediately. And they're like, okay, what can I do now? What should I do now? What am I going to do now? Because there's a huge myth in our community that our community is scared to say the abortion word. That's not true, especially if they know their sister, their cousin, their neighbor. Our community is very compassionate. So once we learn about the limitations about access to care, we are there and we will fight. So that's what gives me hope. So the worst case scenario already feels like almost there already for us. What this also could potentially lead to is, what does it look like in terms of our communities being more targeted than they already are? What does enforcement potentially look like, and who is going to face those repercussions of enforcement? And it's most likely going to be people of color. Yeah. So those are the questions that we're also asking ourselves as we move forward in this case.
Marcella, you heard Anne-Marie already talk about how in many communities, particularly communities of color, we're already in a worst case scenario. Do you think that this decision could make it even worse? Or are you kind of saying like, we're going to keep doing what we're doing and, and this is not going to upend things as much as folks may think that it will?
Well, I think I agree with Anne-Marie that for Black communities, Roe has never been, about actually gaining access to abortion services. I remember when I was growing up, everyone in my community knew the woman who actually performed abortions, and they went to her. Even once Roe was decided, the decision on Roe was decided in '73. There were still women who people went to who they trusted more. And having the right to abortion without having access to it because of your insurance coverage, because of what state you lived in, because of even within the state, what county you lived in, has always been a question mark for communities of color. And I think over the last 10 years, more and more organizations have been paying attention to this access question, where it took women of color coming together and actually saying, hey, access is a question, is a problem. It is not about whether or not we have the legal right. It's about whether or not we can access that legal right, given where we live, given what kind of insurance we have. And I think what we're looking at right now is everybody is now reckoning with the idea that that legal right may not even exist anymore. And so I think the attention that's being paid to this right now is much more salient. The attention that Congress is even paying to the Hyde Amendment and the fact that we have never been able to get the Hyde Amendment eliminated, no matter who has been in control of Congress or the White House. And we have to acknowledge that this is not about conservatives versus liberals or progressives. This is literally about old white men thinking they should control Black women's bodies. And the easiest way they had of controlling Black women's bodies was the Hyde Amendment. And so we see more and more people taking on the Hyde Amendment now, even members of Congress. I don't know if this is going to continue, given that the Supreme Court has now decided to take this case up. What we really need coming out of Congress is codifying Roe v. Wade and codifying it with insurance coverage. That we won't allow, there have been attempts to codify Roe in the past, and they have lost because women of color have said, you can't codify a right without coverage to it, insurance coverage to it. And so those bills have failed. And we're now at the point where we're going to have to do this, codify Roe with insurance coverage for everybody, if indeed Roe is overturned.
As you point out, it really is remarkable to see the evolution in thinking on these issues and really honing in on just how complex they are and how many different aspects need to be addressed, and not just abortion. So we're going to talk about that more in a little bit, but I want to go to Emilia now and ask her, as a researcher, as you think about the year ahead and this case, how does this impact how you're approaching this issue, what you're focusing on, and what can you share with us about what you've heard from people on this issue that's important for folks to keep in mind as these debates start to heat up again?
Well, thank you, Galina. And, it's critically important for us at Guttmacher as researchers to think about how are we asking the questions? How are we working to develop those questions? Who's informing the way we ask those questions? Because the answers that we find or seek to find are only as good and as relevant as the questions that we ask. So engaging in panels, working with our advocates who take our data and turn it into reality, right? Who build the narratives around the data. That is really important. So as we're hearing and feeling, certainly the alarm that's been expressed here, I really want to build on Anne-Marie's and Marcella's comments. I hail from a public health background, right? And we often talk about, there's often a philosophy around, it had been this personal responsibility thing that gets thrown around or had been thrown around, which is about, people make their own choices. Well, people make choices only as much as those choices are realistic and presented to them. And this panel is around the reproductive access and reproductive ability and its relationship with the economy. But I think to build on what Anne-Marie and Marcella were saying about Hyde, the economy has often been used as the most effective tool of oppression, right? It's been used as the tool of oppression on reproductive rights, health, and justice. It's been used as a tool of oppression for sterilization. It's been used as a tool of oppression for economics. So rather than just looking at it as how does better access improve economics, I think we have to have a very present realization of how economics is actually used as a tool of oppression, not always as the tool for escape.
Yeah, and that's a perfect segue to Shannon. I see you nodding in agreement. And of course, this is at the core of the work that you do in Georgia. Can you build on Emilia's sentiments? Oh, I'm sorry, you're muted.
Unmute yourself, Shannon. Okay. Hi, everybody. Grateful to be with you all. Glad to be here. It's like what most people might think of as an unlikely actor within this conversation, as someone that sits at the intersection of economic justice and reproductive justice. The Mississippi case is like personal for me because I started my abortion advocacy work in Mississippi, fighting anti-abortion bills in Mississippi, and now in Georgia, where we've got, Kemp v. Sister Song, and we've got just a political climate that is constantly making us feel like we're clawing at our rights and our freedom and our autonomy. And the way that economic justice and reproductive justice have got to fight this together and increase the rooms and the spaces and the ways that we talk about this subject. Like for me, as Jobs with Justice, I'm totally waiting on my RJ sisters to give me marching orders to go to my labor partners and to say, this is how we need to stand together to fight back and to fight forward. I think what's exciting to me about this moment is we are seeing more leadership like myself in the movement that come out of RJ but are situated in EJ to help us expand the rooms, right? Expand the places that we're having the conversation, that in reproductive justice and rights, we can get a little bit in our silo and think that everyone in the bubble is having the same conversation with the same language. And we've got to make sure that we're bringing the other silos of movement along with us. I'll say the same thing as we're coming up on Pride Month. I'm super excited, right? That our LGBTQ brothers and sisters in the ways that movement and the trans movement are very aware and keen that if we've got to fight for bodily autonomy through talking about abortion, that it is the crux issue that the nation has used to try and say that we don't have the autonomy of our bodies to make these decisions. So I'm just encouraged right now for like the fullness of my history with this issue in this moment that we're able to connect the movements, right? That the leadership, the language, the way that we fight. Earlier, someone spoke to the way the business community has been fighting back on voter suppression. We've seen the business community stand up for trans rights in this last cycle. The LGBTQ, we can get business to stand up there. We did not see the same fight back when it came to the abortion ban in Georgia. So we're still working with business to understand the value of women workers, right? And we know that within pay and inequality, that we see it systematically, that women workers are constantly pushed to the back of policy, that policy is not geared towards any of the issues that women are dealing with, and reproductive issues are definitely last on the meter. So when we're crafting campaigns right now, it really is, how do we make sure that we talk about, the Supreme Court is about to have this conversation, and over the next year, as we wait to see what the progression of this conversation is going to be with the courts, how do we make sure the rooms that are talking about the case are constantly being expanded? So that's what I'm excited to be here on panel with all of you all, because I think it's all about the intersections and how do we recognize women's leadership inside reproductive rights and justice, but in all of the movements that we're leading and taking place.
Yes. Well, and speaking of intersections, I think certainly one of the most important frameworks to come out of the space has been the reproductive justice framework. And I want to go to Marcella for this one. It's a phrase that I think, more folks are growing aware of, but I think sometimes there's still a little bit of confusion about what exactly it is intended to communicate. So I would first and foremost love for you to level set everyone on the reproductive justice framework, and then really talk about why this is how we should be having these conversations instead of limiting it through the abortion lens, which seems to dominate the conversation. Why is this the best framework to be talking about these issues through?
Well, for one thing, reproductive justice is a human rights framework that is also in its first iteration, when 12 Black women got together in Chicago and talked about healthcare, they came up with the terminology of reproductive justice. And it is based in the human rights frame, but also based in Black feminist thought, that it was looking at the full lived experiences of Black women and seeing that nobody lives their life in a silo. It's not like I'm not a Black person in one little place, and then I'm a woman somewhere else, and then I'm a mother somewhere else, and I'm a sister to many sisters and brothers somewhere else, and I'm a professional. your life is all of those intersectional pieces, and that reproductive justice says we should be looking at the whole entirety of a person's lived experiences. And for some, that lived experience, as Shannon mentioned, can be trans, it can be gender nonconforming, it can be gender expansive. All of those pieces have to fit in. We look at economic justice, environmental justice, education justice, housing, as all of those pieces that fit in. We did, not just long ago, we did this poll that will be like rolling out fairly soon. And one of the questions that we asked in all of our polling is, when it comes to deciding to have a family or expanding your family, what are the issues that you look at? And where most people think, of course, you look at whether or not you have the money to afford a baby, where you live. Other kinds of things were much different. People said clean water, to making sure that they had clean water in their household, to making sure that they had city services that kept their streets up in their neighborhoods. They looked at things about healthcare, yes, but they also looked at things about making sure their kids could actually breathe the air where they lived. We know that in a lot of Black communities, when people look at heat is it's several degrees hotter in Black communities very often because of the lack of trees. And so pregnant women in those communities suffer more from heat, as well as stress and other kinds of things that lead to the kind of problems that Black women have in giving birth and the pregnancy related deaths that are caused by that. So all of those things impact and come out to play in reproductive justice. It is looking at all of those things, and abortion is just one part of that. It is a critical part, but it is still one part of it. So as Anne Marie and I said earlier, having the right to an abortion is meaningless if you don't have access to the services, if you can't pay for the services, if you have to travel a long distance to access those services, if you have to take off days of work and you work where you're an hourly worker, so it means you don't get paid when you take off those days. All of those things factor in. And as Shannon mentioned, we are all looking at those kind of cross movements that are all part of our everyday life. They're not really cross movements. They're movements that impact all of us. Yeah. And so that's what reproductive justice really does look at.
Thank you, Marcella. And Shannon, just to build on that, I want to go back to the economic justice piece of this, because of course, today with all of this incredible data that's being shared and really taking a look at the repercussions of these really hostile policies that are being enacted in places, I was struck by the fact that, not surprised, but to see that two of the states most negatively impacted financially, economically, were in the South, Arkansas and Mississippi. And I'd love to hear from you, Georgia, thinking about your neighbors there in the South, what is it that you think they could learn from what Georgia is getting right? And where would you like to see Georgia kind of step up, or what does it have to learn from other places in order to, again, reap the benefits, the economic benefits that come with really supportive infrastructure around reproductive health care and access?
Yeah, I mean, I would say the South as a whole is in a political crisis on this issue, right? That Georgia is, I wouldn't say that we're doing better on this issue in access. I think we just have a larger economy than Arkansas and Mississippi. And we have a different economy than those states. So the report will reflect that in Georgia, we have over 500 Fortune 500 companies. Our median income is, $20,000 and $30,000 more than the other two states. But as far as the ground game, I would say that the sisterhood of leaders that work together across Arkansas, Mississippi, Georgia, Alabama, it's been tight for decades. The sharing of knowledge, information, resources, training, that has been there, and I think will continue to be there. And I think that what we're seeing in Georgia that we're not seeing as loudly in other places is the political battle, right? That we know politically, we're moving Georgia. Everyone says we just went blue, right? We went blue on a federal level, but we still have a lot of ground to gain on the state level. So our state policies, like where these issues are truly governed, we're all fighting the same bills. We will see the same bill come in to Georgia that comes into Alabama, that comes into Arkansas, that comes into Mississippi. So we are still in the need for us to develop the political power to put down these bills across the Southern region. And the more that we learn the skills of like turning our counties and our cities into the political dynamics that we need for these issues, we're sharing those tools that the voter education and civic engagement folks in Mississippi and Georgia, we're all working together right now. We're preparing, right? Because the way we're going to win on these issues is a political as well as a cultural and ground strategy for us to expand access and actually actualize our vision around reproductive justice for the South.
Absolutely. Policy is going to be so key moving forward. So Anne Marie, I'm going to come to you with the policy question. I'd be curious to know if there are any pieces of legislation right now that you feel are really, really vital to unlocking a lot of what we're talking about here. And as a secondary question to that, if there was a piece of legislation that you could introduce that hasn't been introduced or that folks haven't been thinking about that you think could really drive impact, what would that look like?
Thank you so much. Well, I can go in so many different directions in this question because when I think about this issue, there's like not one thing, right? There's not one bill that can fix everything. Because if there was one bill, we would have solved this, coming all together. I think it would have been solved. So I'm thinking of what's really important that we've been working on in Latina Institute is really trying to push what's our vision? Like, what do we want to live? How do we want to live? Right? Because we keep getting attacked, and defense is important. What is it that we really want? Where is it that we want to go? So one example that we're living that is in Virginia. Right? One of our core values that everyone living in our country, everyone, should have access to a full range of reproductive health care, including abortion, and it should be regardless of their income, regardless of their race, regardless of their gender identity, regardless of the sexual orientation, regardless of their immigration status. None of that should matter. I almost cursed. I'm a New Yorker, so sometimes I have to pause. None of that should matter. So there's a bill that we are working really hard on in Virginia, and we know it's a long process, right? You have to start somewhere so you can put your vision out there, and we're sticking to it. And it's the shorthand is RHEA, which is the Reproductive Health Equity Act, and we have Reproductive Justice champions, Delegate Marcia Price, who we're really proud to be working with to continue leading on this charge of this bill. And in essence, what it does is it protects and expands the access to full range of reproductive health care, and it includes prenatal care, it does childbirth, it does postpartum care, and there's language in there that it's regardless of somebody's income and their immigration status, gender identity, or their type of insurance. And we're holding strong to all of those elements. Because for our communities, like Marcella was saying, you can't divide yourself up into before you enter the clinic, right? When you enter the clinic, you have all of these identities that you need to work through to get to the door, just to get to that clinic before that clinic can open its door. So this bill will help address all of those elements so that access is real, so that people can have that choice. Just like Herminia was saying, was like, if you don't have access if you, how did you say it? You say available or presented, the choice available or presented. I liked how you said that. It's just like, yes. Like if it's not, if you can't see it and you can't touch it, then you can't be it, right? And that's the realities of our community. So that's why this bill is really, really important for us. That's why we're going to keep fighting for it. That's why we're going to keep pushing our vision. And work like this is very exciting, but it's just one piece of the puzzle, I would say.
So if there are so many pieces of this ginormous puzzle, and Minia, how do folks start to put pressure? Let's focus on business leaders, since that's the focus of the conversation today. And that's really, I think, an under-leveraged player in all of this. How do folks start to put pressure in ways that are effective in moving the needle on some of these policies? You know, you're going to solve it all for us, so no pressure.
Well, I think part of it is, I think it was Marcella who was talking about the very different ways in which this was playing out. That's not accidental, right? There has been an intentional, well-funded, I might add, long-term game plan to, oppress here and make these changes here and put these little laws here and put these little laws here. And part of the game plan, I think, is to keep us distracted by seeing only the pieces. One of the contributions that Guttmacher is trying to make, as you see by some of our, tracking, is not just sort of catalog what the, for example, what the state enactments are and what the introductions are, but to actually try to pull these pieces together and say, hey, look, when you add these up in Louisiana, when you add these 60 whatever plus anti-abortion, restrictive laws up, that tells a really different picture than if you are focused on one at a time. So it's both producing the data, but it's also connecting the dots between the data. It's also weaving the storyline around the data so that people have, like businesses, have access, are not, summarily distracted. Distraction is part of the opposition ground game. And so one of the things that we want to do with our research, when we're thinking about what research is important for impact, is to start to dissipate the clouds of distraction and say, believe your eyes, what you're seeing is real. Take this information and run with it.
Great. I'm actually going to start going into some of the audience questions, because we've got a few good ones and I want to make sure that folks are being heard. So I'll start with this one and I'll direct it toward, folks who are doing the on the ground work. The George Floyd protest this summer showed how powerful getting into the streets can be. Is there a way to continually mobilize women to say no to limiting access? How do we start to make this feel more urgent? And I'll be honest, this is something that we at Rewire News Group, as we're covering all of this stuff that's happening, I mean, we all know every single day, right? There's something terrible happening in this space, but getting folks to pay attention, getting folks to engage, getting folks to understand why this is something that that matters and they need to be paying attention to is really, really hard. You're competing for attention, you're competing for energy. So this idea of mobilizing folks to actually go out there and start advocating for change in the streets, what is it going to take to do that? Is there a moment where it's going to feel right? And how do we start to get folks ready for an action like that? Or do we not think that that's effective? Would love for anyone to jump in on that. Marcella.
I think, well, it's interesting because if you think about what happened over the summer, it was spontaneous, it was widespread, it went to every state, it went to countries. There was something about watching this police officer murder this Black man with almost disdain about what he was doing. I mean, and watching other people saying, you're killing him, you got to stop. And he just didn't. And I think that what that did is it finally told the story of what Black and brown people have been saying about police abuse for decades. And so we saw this. And if you think about the protest issue, there's a reason why these state legislatures are now coming up with these bills to stop protests, because they know the impact. What happens when people of all ages, of all races, take to the streets and say, we will not take this anymore. This is enough. And it makes a difference. It made a difference in how people perceived the Black Lives Matters movement. It made a difference in how people perceived some of the things that came later, where if you remember, there were instances where white women called the police against Black people and lied about what was going on, and then were confronted by the lie. There were those kind of instances that people realize just what that means. We're seeing it in the attacks on Asian Americans here because of what Trump labeled the coronavirus as. We're seeing it in all of this. We saw it at the border when people were literally yanking babies away from their parents. All of that said, this is not the America that we expected. This is not the America that we promised people. And I think what those protests have said is, it makes a difference. We can unelect you if you don't follow just decency. And we saw that with Trump. We're seeing it with other people. And that's why all these bills are coming up to outlaw protests and say any protest that causes property damage is now going to be a felony. And then you had all these militia who attacked the Capitol and caused property damage. And you've got now the conservatives trying to explain that away as, oh, this was not really that bad. This was like a tour of the Capitol. You go like, that's not the kind of tour I've ever been on. But it is this thing that says taking to the streets does make a difference. It does get more people on your side. It does call for a reckoning that that we now see happening in government, that people are all saying racial justice is something we really should be looking at. And I think that this will happen also if indeed the Supreme Court really does overturn or gut Roe. I think you're going to see women take to the streets, and men of all different ages take to the streets and say, you cannot keep using laws to oppress our bodies. And yeah, so I think protests are out there.
Yeah,
Fantastic.
I can add one thing to that also.
Yes, please.
Is one of the increased parts of this, not increase, it's been a conversation for a very long time, is also, what does it mean to be a Black mom in the United States? What does it mean to be an immigrant mom in the United States, or parent or guardian? And that's part of this whole conversation too. That is like a centerpiece of that conversation. When I'm out there on the streets and I see signs of it's about, the last words that we can repeat, right? So this is also about family. This is also about being able to thrive in this community with health, dignity, and justice. So all of these issues are intertwined. That's why leaning in on intersections is the path forward, because we cannot separate ourselves. You can't go seek healthcare from a doctor if they're going to discriminate against you, right? You can't call the cops for safety. You can't rely on any of the infrastructure that we rely on to help a community thrive. And so that's why reproductive justice work, this framework is home to us. This is what's going to help us move forward, right? We cannot separate these issues at all. So these protests are important, they matter, they work, just like Marcella said. Otherwise, we wouldn't be seeing these laws trying to prohibit what's happening right now. And that lifting up the intersectionality of it all will only make us stronger.
So protest, clearly a very powerful tool in helping to drive and reshape important conversations. Another question that we have from an audience member is, what is the role of unions and employee organizing for improving access to reproductive? We've talked a lot today about what corporations need to do, what small businesses need to do. But what about folks, you know, who are leading employee organizing efforts and unions? Does anyone have specific examples of good practices? Yes, go Shannon.
Yeah, so I mean, I think number one issue that I think is winnable in front of us right now, that we're seeing it with the American Jobs Plan, is that we've got to get this paid leave situation in order. That Marcella, you leaned on it when we say that an hourly worker who is trying to access reproductive care across the spectrum of care, whether that's abortion to just prenatal, whatever the need is, they need the time off paid, right? So paid leave is a issue that unions are the ones who have won, right? The only people who have really, set the standards for paid leave in the country are union contracts. So the more that unions train and teach workers how to win paid leave campaigns, the more that we fight for state policies around paid leave, are ways that unions and employee organizing can provide more reinforcements to the fight for reproductive justice. I think in addition to paid leave, it is, health benefits, right? Sorry. So I think that we have lost a lot over the years in our union contracts, unfortunately, is compensation for healthcare. So the ways that we need to, fight together to expand Medicaid, as we fight for good healthcare benefits within union contracts, we also need to have a good contract between the general public and all workers for healthcare, right? That in expanding Medicaid is critical for low wage workers in that conversation, for us guaranteeing, because it is an uphill battle for us to get these corporations to again take responsibility for healthcare. And we are looking for a governmental solution, I would say, more than a union, but it's going to take unions and community fighting together to make sure that we do healthcare access and that we do paid leave access at the same time.
Fantastic, thank you. Philanthropy obviously also plays a big role in all of this. So another question from one of our attendees today is, what do you want to see from philanthropists as we move ahead? Calling out the fact that people's lives are on the line right now. So yes, we're advocating for policy. Yes, there are real systemic changes that need to happen, but that takes time. What can be done right now by the folks with deep pockets to support reproductive justice efforts? Go ahead, Herminia.
So I'll start out just thinking about sort of the various tools that different sectors have to bring to bear to the table, right? And one of the tools that philanthropy has, in a way that I think many other sort of institutional perspectives don't, they have the convening power of the purse, right? And as we talk about these, the ability for cross-movement collaboration and bandwidth, right? Well, cross-movement collaboration comes at a cost, right? And philanthropy can support those costs in a very real and meaningful way, without being sort of overly directive, but can really sort of free up the resources, add the additional resources to allow for meaningful cross-collaboration work in a way that's not a zero-sum game. And that really allows the elaboration of strategy to move forward without people feeling like, what do I take off of my plate in order to help, because I think there's a lot of goodwill across collaborations, but there's not a lot of resources across these collaborations. So that's one idea for philanthropy.
Great. And Shannon, I know, wants to jump in here.
Yeah, I just want to piggyback on that. So like we're in a collaborative that Proteus convenes that is Rights, Faith, and Democracy, and it is bringing labor, LGBTQ, women's rights, and voting rights together. All unlikely partners, right? That as labor, you know, we tend to fight corporations that the LGBT community is able to rely on to beat back oppressive bills, right? So there's a contradiction, a rub between LGBTQ and labor often. There's a rub between LGBTQ and women's rights often. And these are historical rubs, and we've all known each other forever. But because of the Philanthropy Collaborative, we were able to hire good facilitation. And it's that I want philanthropy to hear, that like, one, yes, the money does help us come together, putting unlikely actors together and funding the necessary facilitation, right? That oftentimes it's not just, do we give enough for another staff person to be added, but are we going to pay to facilitate the natural issue rubs that exist within these battles? There's reasons we haven't worked together, and we need actual processes to address those reasons, and they need to be done in like non-traditional things that we think of, that we might have a healer as our facilitator, because we've had issues, you know, over decades that we've got to resolve, and we need philanthropy's support in that, because we will not step to those relationships because they are conflict relationships, and we need the processes and the funding to address the conflicts and expand the capacity at the same time.
For sure. And I know Anne Marie wants to add some thoughts here.
Thank you very much. I would say yes, thank you. And also, our organizations are the ones that are most under-resourced and most asked of in moments of crisis to step up. So infrastructure, and really centering in organizations of color. Not that only led, but the work is about centering our community. I think that is really important, because this work is not fast. It is slow. It takes time. Our reports are going to yield results 5 years from when you started funding us. You know, they're not going to result immediately. So I would say those things: infrastructure, knowing that the work is going to be long, and that consistent investments in organizations that are led by people of color and are for people of color is where funders should focus their energies on.
Great. Next question, going back to our conversation about some of the states in the South that are most negatively impacted. The question is about, can we talk about some of the change-making work that is happening in the Deep South? That so often the story that we tell about the Deep South is rooted in this needing intervention, not doing things well framework. But there's actually a lot of real change-making justice work that is happening in those communities. And can we share some stories and talk about what's happening on the ground there?
Yeah, I can talk a little bit about some of that. We work with a number of different Black reproductive justice organizations. Some are in the South. We have 2 partners that are in Georgia. We have a partner in Tennessee, in Texas, in Louisiana. And recently we've worked with the Louisiana, which is Women with a Vision, in Tennessee, Sister Reach, and in Texas, the AFIA Center, to actually do a project that was called the Deep South Collaborative, in which we also did outreach work in Alabama, Arkansas, Kentucky, and Mississippi. So those 7 states did some collaborative work together. We did polling in those states to find out where Black women stood on a variety of issues, including abortion, but also on police violence, on racism, on issues that they felt were most important in their community, on issues around economics in terms of pay equity, and to work on some of the work that we do around our I Am a Voter campaign, that we also work specifically with trying to change state legislatures. because again, we're fully aware that, you know, Black women turn out in large numbers in presidential elections. They've been turning out in large numbers in midterm elections. What they don't always turn out in large numbers is local and state elections. And we've seen what Georgia has done in turning people out for some of those elections, and what we expect will happen again in 2022 in terms of turning out for statewide elections. But our I'm a Voter campaign is specifically directed at changing local and state legislatures, because that's where these bad laws happen. And that's where the mobilization has to happen. And that's where the vast majority of Black women, Black communities live, are in the South. And so we've worked very carefully with Sister Reach, with Sister Love, and Spark Reproductive Justice now in Georgia, to actually do that kind of work of reaching out to Black women voters around local and state races as well, to make sure that those kind of changes are happening, and to actually put organizers on the ground in those states that will
Which
work.
could truly be game changing.
Right.
Yeah.
Yeah.
Yeah. Shannon, I get the sense that you want to jump in here.
I mean, you know, the South is just what I love and what I do. So I think, I'll keep it really simple, that like, we're all trained that the way of the South is the way of the world, right? And I like to remind us that the South led us into some of the darkest history of this country. And I genuinely believe that because that's the history, we are going to lead us into some of the brightest history of this country. That if we firmly believe the directly impacted people are where we're going to get the greatest resolve, then we know the directly impacted people of the South are going to deliver us some of the greatest policies that give us our greatest freedom and liberation as well. So that's my message about why we're going to keep focusing on the South, keep listening to Southern leaders. I think some of the best strategy and some of the best resolution to the problems are coming out of the direct impact zone. So, you know, I'm excited to share with folks, but I will also say this: the South got taken over, it took over the whole country. That with 45's election, we used to say, welcome to Mississippi, America, right? That where everyone needs to hear how we win in the South, how we beat back white supremacy when it is bleeding so boldly in our face, right? That every win that a Southern organizer has ever had, it's been had against the toughest white supremacy in the country. So we don't win quick. We don't win lightly, but we do win in the South still. So I just, you know, I look like 15. People didn't think 15 was possible in the South. Shout out to all the workers that are going on strike today across the country in service of 15, in service of breaking McDonald's into being a corporation that stops creating poverty in our country and actually starts paying living wages. So, you know, that's a Southern movement. It's been so many Southern workers that have put their livelihood on the line, taken the retaliation, taken the what comes back when you fight for justice in the South. And we just got to keep listening to those struggles and hearing how we endure and sustain to win.
Incredibly inspiring. Thank you, Shannon, for that. Last question from the audience that I'll take today. Another player in all of this, of course, is the media. And the question is, how are you addressing media outreach, messaging, and role in educating the public? You know, as this attendee points out, so often there are inaccuracies on these issues. You know, this is exactly right why Rewire News Group exists, because this area is so rife with misinformation. And there's such a compelling need for accurate, trustworthy information. But certainly, I don't think that we're seeing necessarily the mainstream media messaging catching up, or the way that these issues are reporting on catching up with what's actually happening in the space. But I would love to hear from some of you about, you know, whether you see progress being made, where you see the weak points being, and what you think is needed in order to get better coverage and better conversations around this. Amelia, go ahead.
So, you know, I think for us, as we thinking about especially facts, right? And that facts really do matter, and facts stopped mattering for, you know, quite some time, right? They've never mattered as much as, you know, a research organization would like them to matter, but they stopped mattering altogether. And I think that we need to step into this moment to really make sure that we are talking to the media in ways that reminds them of the role that they can play for either the light side or the dark side of the force, right? And that there's real responsibility there in conveying the facts and in weaving the storylines around those facts in a way that's meaningful, relevant, and reliable, and in a way that doesn't necessarily garnish the juiciest headlines. But I think there is I'm hoping that there's some understanding and reflection, both in the media, and we've been talking here about the way that communities of color, I know that there's a very similar movement happening in journalism, right? And who are the journalists who report? What are the questions that they ask? What are the storylines? Who are the editors making decisions about those stories and how communities are covered? Why is a police report taken as sort of the final take on what happened rather than digging deeper, right? Journalists of color might ask a different set of questions. So I think that we also need to support that, talking about intersectionality, really also supporting a transformation in the world of journalism around the way in which, what facts for whom on what timeline are important.
Thank you. Yeah, it does feel like this really transformative moment, a moment of reckoning for a lot of institutions, that hopefully the work is going to happen. And that's the last question that I'd like to end this conversation on, knowing that we only have 3 minutes left. So many great ideas, so many, important issues being raised and talk about, especially in this area of, the conversation about economic impact and how corporations and businesses can get involved in making a difference when it comes to these restrictive policies that we're seeing. How do we go from great ideas and words to action? How do we move the needle here? There's so much lip service being paid to these great ideas. Everyone's in favor of gender equity. How does that start to actually live in the real world? What is it going to take? Anne-Marie, you look like you want to jump in here.
Again, I wish there was one way to answer this question, but there isn't. So I was thinking, a lot of our work, we lead it through what we call the wheel of change, right? And part of our wheel of change is hearts, minds, and process, right? So no change is going to be possible unless you can change the hearts, you can change the minds, and you can change the processes under which those are operating, right? Be it legislation, be it work policies within the organizations. So those are how we do that. And we share that kind of thinking wheel of change with the folks on the ground. If we don't, the quote is that many people change, or say it differently. It's like, change doesn't happen in DC, change comes to DC, right? So our work is all about ground game, all about and doing it through changing hearts, minds, and process. That's the only way we're going to do it. So whenever people think about how do we do gender equity, you have to think of all of those elements. What is it that we need to change internally within ourselves? And what are the processes that protocols that we have within, every level? Even think within your organization. Like, what are in the job descriptions? What do they say, right? What does our language look like? Is it inclusive language? Like, thinking of all of those elements. And the only way we're going to do it is with the people. That's it. Just community on the ground, community time and time again. It is the community and those most impacted.
Shannon, your work on the ground.
The microphone should be handed over.
Sorry.
Yes, thank you. No, I can keep going. Sorry. Thank you.
No, I think Anna just hit it actually perfectly, that it is about the ground game, right? That I feel like media is important, but we've also figured out that we can talk to 400,000 people in a week, right? That our text game is on fire, right? That like we can get to a few million people real fast. And I think the more we can do that, and the more what we're getting to them is an echo of their own vision, right? The more we will expand who's in this fight with us and how. I want to caution us about, we don't live in one society, right? that there are multiple experiences, there are multiple pain points. And how are we making sure that our communication is like competent to those multiple pain points and coming from the people who are experiencing that pain, that we can get into our grass toppy cute silos of life, right? But taking that conversation and really making sure that the base is getting it, but then repeating it back to us in the frame that they understand it and need it the most. Does that make sense? We bring a message to the people, but then we kind of let them give us the response on the call, and then we echo that. Right? Because we're, researchers, and a lot of us have pulled ourselves out of some pain points, and we just, need to remember all the stuff.
And Armenia, what does the research say about converting words into action?
So I think the honest answer is it's really hard to do. And that as folks were talking about sort of keeping nose to the grind, right? These are long games. It requires multiple tools. There's no single research strategy that's perfect. We're trying to add different tools. We have some like great trend lines that we, on some of our products, that of some of our research analyses that we've been doing for decades. And it's really important to have those trend lines over time. We've also moved to doing more and more sort of just-in-time research, right? During COVID, we fielded new questions to ask, how is this pandemic affecting your decisions about, do you want to have children? Do you want to have the same number of children you did a year ago? And lo and behold, there were different decisions made around people's desires to have children. There were differential access to contraceptive care. Unsurprising to anybody on this call, those burdens were borne disproportionately by women of color. So, so keeping the research, the questions relevant, keeping the data fresh, putting the data quickly into the hands of people at the right time who are deliberating decisions, as well as into the journals for, for peer review. All of those things are important. There's no single magic pill, to Anne Marie's point, or we would have done it already, right? But we have to keep pedal to the metal.
Sure. And of course, I have to give Marcella the last word. She has been doing this work for 40 years. Marcella, send us out with some hope.
Well, I think that what we heard from everybody is that change requires a lot of different pieces. And it's policy, it's culture, it's community, it's individuals who actually come out and do action. And it's also listening. One of the things that we know is trying to get politicians to listen to you means that you have to go out and get their constituents to scream at them, because that's the only ones who they pay attention to, them and their donors who help them get elected. But for the most part, it's their constituents. And we listened to that. We worked with, just this past several months, we've been working with almost 30 Black RJ organizations and individuals to develop a Black reproductive justice policy agenda that we're rolling out in June, that's directed at Congress, that has what we call proactive policy that we believe will help benefit Black communities. And it's a wide range of issues and stuff that looks at all of these intersectional pieces. And I think, and I know that Latina Institute is doing something similar. The National Asian Pacific American Women's Forum is doing something similar. And then all three of us are working together on some intersectional pieces that we work on. And I think that's where you get change. You get change from seeing your strengths in terms of your own communities, but also cross movements, cross communities, something that Shannon raised about getting people to work together to really say, we're going to make changes here, and we're going to make them in spite of the laws that are being pushed back at us to stop us, in spite of the barriers that we face, because we don't have any other choice. The reality is it's about the future of our children and keep pushing, keep working. And I think that's what you heard from everybody today.
Well, I'd like to thank IWPR for bringing all of us together today, and for all of to all of you, thank you for the incredible conversation. I'm going to turn it back over to Michelle.
Thank you, Galina, and thank you everyone for bringing such important pieces to today's conversation. And really just, there's so much learning. I've been getting messages being like, I'm learning so much. This is great. These panelists are amazing. All of these issues are so important, and being able to weave them all together and to connect the work that is being done, the urgent need for all of these, all of the movements you are leading. I want to, thank the speakers again, both the panelists who are just finishing now, and also the conversations from earlier today. So thank you to everyone for being a part of today's event. I want to thank the Terra Health Foundation for supporting the tool that was launched today and that research, and for really putting money behind monetizing the cost of restrictions and elevating that, and bringing to the table businesses and elected officials, and another tool to use as we engage with advocates against the growing fights. So please make sure you check the tool out. It is the beginning of what will continue to be a growing project. So we look forward to continuing to be engaged with all of you, to your feedback as you use the tool. If there are pieces that you wish were there and are not, that should be part of the next phase for that research for IWPR. Please let us know and stay informed and in communication with us. For the Center on the Economics of Reproductive Health, we are very excited to continue bringing conversations like today together, and all of the different fields, and cross-pollinating, and bringing research and media and grassroots work, because as so many of you mentioned, we don't exist in silos. We all wear many different hats and play many roles, and being able to have conversations like this, which acknowledge that and bring all of those pieces together. So thank you for that. And we hope to continue to be doing that, and to really bring research that is centered around those who are most impacted by all of the different pieces that were discussed today, whether it's unfair labor laws, the pay gap, individuals who are undocumented, how COVID is impacting communities of color and leading to a big she session. Those are kind of the conversations that we want to continue to be a part of, and hope to be at the forefront of continuing to build data around that, and building that evidence in partnership with all of you guys. So thank you. Wanting to make sure that it continues to be community informed in our research, and that it's meant not, as was mentioned, it's great. We need to get the data out to the people making the decisions, but we need to also get it back to the people who inform the data, and to make sure that they're a part of the process, so that we are including labels when we're collecting data that people identify with. So as a researcher, as an immigrant and a Latina myself, there are so many pieces that I am excited to be working on here. And yeah, thanks for joining. Thanks for listening. Let's not end this conversation today. Please keep it coming and going. I want to thank the Heal It Foundation for funding the work at the Center for Economics of Reproductive Health, and also making today possible. And Nicole sends everyone big thank yous. Thanks again, everyone, for your time. Have a wonderful rest of your day. This panel and the ones previously have all been recorded, and we will make the recording available on our website, and make sure to share with everyone once it's up so people can access it. Yeah, I think that's it for me. So thank you guys so much. Galina, thanks for doing such an amazing job moderating. And for all you do to cover the important work everyone is doing. Have a wonderful day, guys.
Thank you.
Bye.
Bye.